Many people assume that if they are the one being stimulated during oral sex, they cannot contract sexually transmitted infections, STIs. This misconception leaves men vulnerable to infections that can affect their urethra, penis, and overall health. The mouth is home to a diverse community of bacteria, viruses, and fungi. When oral flora contacts the sterile environment of the urethra, microorganisms can migrate and cause inflammation or infection. This article dispels myths about receiving oral sex and outlines the infections that can be transmitted, along with strategies to reduce risk while maintaining intimacy. Oral flora versus urethral environment. The human mouth hosts billions of microbes, bacteria, fungi, and viruses that typically coexist without causing harm. The urethra, by contrast, is a nearly sterile passage designed for urine and semen. During oral sex, these two biological worlds meet. Microorganisms from the oral cavity can colonize the urethral lining, leading to inflammation and infection. The risk is heightened when the oral partner has an active infection, even if they have no symptoms. Infections transmitted by receiving oral sex. 1. Human papillomavirus, HPV. HPV is the most common STI globally. Many people know HPV can cause genital warts and cervical cancer, but it can also infect the mouth and throat. Oral HPV infections often have no symptoms, which means a partner might be unaware they are contagious. Transmission during oral sex can lead to genital warts on the penis, and more seriously, increase the risk of penile cancer. 2. Candidiasis, yeast infection. Oral thrush, an overgrowth of candida fungi in the mouth, can be passed to the penis. This can cause balanitis, an inflammation of the glands and foreskin characterized by redness, itching, and a thick white discharge. Good oral hygiene and treating thrush promptly reduce this risk. 3. Herpes simplex virus, HSV-1. The virus that causes cold sores, HSV-1, is highly contagious when lesions are present. If a person with an active cold sore performs oral sex, they can transmit HSV-1 to the genital area, resulting in genital herpes. Genital HSV-1 can recur and may be mistaken for HSV-2, underscoring the importance of preventing exposure during outbreaks. 4. Syphilis. The first stage of syphilis includes a painless ulcer called a chancre. This sore can occur in the mouth or throat and may go unnoticed. If it contacts penile tissue, the Treponema pallidum bacteria enter through small abrasions, leading to infection. Untreated syphilis can cause serious complications. Early diagnosis and antibiotic treatment are essential. 5. Gonorrhea and chlamydia, throat infections. Neisseria gonorrhoeae and Chlamydia trachomatis can infect the throat after performing oral sex on an infected partner. These pharyngeal infections are often asymptomatic, but they can be transmitted during oral sex to a recipient's urethra. Men may later experience burning with urination or discharge and feel bewildered because they did not have penetrative intercourse. 6. Bacterial urethritis. Even without specific pathogens, the introduction of oral bacteria can cause non-specific urethritis, resulting in burning or discomfort when urinating and clear or cloudy discharge. This underscores that any disruption of urethral sterility can trigger inflammation. Protection strategies. 1. Barrier methods. The most effective way to prevent transmission of infections during oral sex is to use condoms. Flavored and ultra-thin condoms are designed to make oral sex more palatable while creating a barrier that blocks viruses, bacteria, and fungi. Men should consider using condoms when receiving oral sex from partners whose STI status is unknown. 2. Communication and testing. Honest conversations with partners about sexual history, testing, and symptoms are key. Many oral infections, especially throat gonorrhea or chlamydia, are asymptomatic. Regular STI testing for both partners reduces the risk of unknowingly transmitting infections. Avoid receiving oral sex from a partner with an active cold sore or unexplained mouth sore. 3. Vaccination. Vaccines are available for HPV and hepatitis B, two viruses that can be transmitted through oral sex. Vaccination reduces the risk of cancer and liver disease associated with these infections. Discuss vaccination with a healthcare provider if you have not already been immunized. 4. Good oral and genital hygiene. Oral hygiene reduces bacterial load in the mouth, and genital hygiene maintains urethral health. Brushing, flossing, and dental checkups lower the risk of oral infections. Washing the genital area before and after sexual activity helps maintain cleanliness. 5. Monitoring symptoms. After receiving oral sex, pay attention to signs of infection such as burning during urination, discharge, sores, redness, or swelling. Seek medical evaluation promptly if symptoms arise. Many STIs are curable when diagnosed early. Balancing pleasure and safety. Oral sex is an intimate and pleasurable act that many couples enjoy. Becoming informed about the risks does not mean avoiding the activity altogether. Instead, it empowers you to make safer choices. Using condoms, engaging in open communication with partners, and staying up to date on testing and vaccinations allow you to enjoy intimacy while protecting yourself and your partners. Remember that receiving oral sex is not risk-free. Understanding the biology of infection and taking reasonable precautions makes this form of sex much safer. Sexual health education aims to remove shame and misinformation. Sharing accurate information with your partners fosters trust and helps you both make informed decisions. If you are concerned about STIs or have questions about prevention, consult a healthcare provider or sexual health clinic. Empower yourself with knowledge and take steps to safeguard your health without sacrificing intimacy.